FMTalk.com.
Welcome back to Vital Signs, along with Dr. Randy Tobler. I am Kelly Webb, and we are so pleased and proud, if you haven't noticed by the theme music this morning, to have Dr. Michael Jones. He is a surgeon at Illinois Eye Surgeons. He is fabulous. He is just an all-around fantastic doc. And Dr. Jones, you went to my alma mater.
Okay, good.
So see, he says
outnumbered.
wash you. That's right.
I'm outnumbered.
The Billikens have taken over whatever you are. I'm not
sure
sure
you'll be
what to
rooting
watch
for the
you.
Billikens in the tournament.
That's right. That's right.
Now, I tell you, we are so fortunate in this community to have such great medical care and education. I mean, I had the pleasure of working at St. Mary's Health Center with the OBGYN department at St. Louis U for so long, and I mean, they're both prestigious places, and so we have a lot of fun with the crosstown rivalry.
Yeah,
but,
right. It's more
Dr.
fun
Jones,
than
of course. Yeah, trained at St. Louis University School of Medicine in 2003, and of course has honors and accolades, and well-deserved. One of the leading premium lens implanters in the country. Is that different from the lens implanting you're talking about with cataract surgery with LensX?
Well, no. We use them in conjunction. What happens is once we remove the cataract, we have to replace it with a lens implant. Everyone gets some type of lens implant. Like I was talking with Mary about her mother, everyone gets something. And it used to be, 6-7 years ago, everyone got the exact same type of lens implant. Well, there are now lens implants that we refer to as premium lens implants that can really customize the vision to the patient's needs. Mainly what we recommend is the lens implant that's a full range of vision. So it's distance, intermediate, and a near vision lens implant so that patients won't need correction at any distance once their surgery is done. So, yeah, we use that in conjunction with the LensX. So you're talking about really customization to give the patient just what they want.
So premium lens implant, you don't mean it just has more octane and costs a couple bucks more?
That's right. It's not fully covered by the insurance. There is some out-of-pocket expense, and it does.
Yeah.
It's costing a little bit more, but you have to treat it like an investment. I mean, if you come in at age 60 and get cataract surgery and you never have to buy a pair of glasses again, that's an investment that will probably pay off.
Oh, wow. You bet.
Mary's mom at age 85, you have to question that investment in getting the fancy lens. But in the younger patients, I mean, it's definitely an investment that will pay off if they never need glasses again. And that's for any distance. So readers, computer glasses, those things would not be necessary with a premium lens implant.
Dr. Michael Jones, let's go to the phone lines because they are all ready to go for you. And your first up is Dave. Hi, Dave. You're on with the air with Dr. Michael Jones.
Hi, how are you, doctors? Thanks for being there. I'm a 48-year-old guy, and I have two issues. One is myopia and bad astigmatism. My question is there any type of surgical intervention for adult myopia, or is that more of a neurological issue?
No. Yeah. Hi, Dave. Your age is interesting here. We have some rules in our practice that we try to stick to. If you're under age 45 and your prescription and eye will allow it, we prefer to do simple LASIK on the surface of your eye to correct your prescription. You say you have a lot of astigmatism. It would all depend on how much you have. And if you're over age 50, we actually try to talk you out of getting LASIK, and we'd prefer that you do the more permanent procedure, the lens replacement surgery with LensX like we're talking about. You fall in that gray area that seems a lot of people do between age 45 and 50. And you have to look at this, again, as an investment because you'll be paying out of pocket for these procedures. If we do a permanent fix for your vision at age 48 with a lens replacement, even though it's a more invasive surgery because we do have to enter into the eye, that investment's probably going to be better for you than doing a LASIK procedure that may only last you 5 to 10 years because your eye is going to continue to age. So you fall in that gray area, but I think I would recommend doing a lens replacement surgery. What's great for you is that technology now allows us to fully correct astigmatism and myopia at the time of your lens replacement surgery. So you're needing to get things done at the right time, that's for sure.
No, that's quite frankly wonderful. It's wonderful news. That's wonderful news. I appreciate it, and I'll be following up with you guys.
Thank you. And Dr. Jones, that brought me to our next question. How can patients or potential patients get in touch with you?
We have several ways. First of all, the good old internet. Our website's www.illinoiseye.com. They can call our toll-free number at 1-855-260-EYES, E-Y-E-S. Do you see what I did there? It's kind of like your trailer music that you're reading.
Oh, there's more where that came from.
We also are really getting into the social media like Facebook. We have a fantastic active Facebook page where we'll update our new procedures on there. We just did another new laser procedure downstairs on Tuesday with one of our doctors, Dr. Edelstein. So anytime we do these new procedures, we'll post the videos right away on Facebook for people to see. In fact, there are videos of the LASIK, the new LensX procedure, this laser procedure that Dr. Edelstein did. We put them on as soon as they're done. We video all that stuff in high def. So website, toll-free number, Facebook page. We also have an iPhone and an Android app.
Wow!
The apps are cool because, first of all, they'll give you a map to the office so you can come see me. That's important. But what's really cool about them is they have all sorts of instructional videos on there about everything that we just talked about. David could go on there and pull up a video that talks about lens replacement surgery for someone who has astigmatism. The videos are very clearly marked, and they're very short, easy to download right on your phone and or iPad even. So check out the apps too. So lots of ways to get a hold of me.
And can we link to those? I know there's if you go to the illinoiseye.com, your website, for those of you who may have weak stomachs, you may want to stay away from the actual video of the LensX procedure because it's a little, for some people, they don't do well with actually seeing those medical procedures, but it's fascinating. I mean, if you really want to see how it works, it's amazing the way the machine sort of gauges what needs to be done, and then I don't know. To me, it just seems like it couldn't be more precise, and I know that you shared that with me.
Yeah, it's amazing. I mean, the more and more of these we do, the more excited we get about it. Some of the videos where we show the actual surgical part, I mean, they can make you queasy, but no more queasy than an OBGYN surgery, I'm sure.
Yeah, well, I mean, we can't show that on a family show anyway most of the time. Now, so can the apps be downloaded here from by navigating to your website on the web?
Right.
Or do you go to
the very bottom of the home page, it's got the icon for either the Android Marketplace or the App Store, and you can go right into it to download the app.
Sounds great. Let's go to Judy next, who has a question for Dr. Michael Jones with Illinois Eye Surgeons. Go ahead, Judy.
Hi. Can everyone hear me?
Mm-hmm.
Yes.
Okay. I'm a 66-year-old lady with Fuchs disease. I also have retinal issues. I have dry eyes, and I'm myopic, and I have presbyopia and astigmatism. And I'm currently taking like Restasis eye drops and other lubricant eye drops. And my problems now is glare. I also have cataracts. I think they're rated probably at just a 1 or a 2 right now. The ophthalmologist I'm going to is saying that I'm not really ready for a cataract surgery and that it would not improve my vision because my principal problem here is the cornea with the Fuchs disease. Okay. And as I understand it, the problem with getting a cataract done with the Fuchs disease is probably irritating or disturbing that fragile cornea. I just would like to hear Dr. Jones's ideas on this.
Yeah. Judy, can you hear me? Can you hear me, Judy? Is it Judy?
I think she may have dropped off.
Okay,
Hello?
yeah.
Well,
she has a
there you are. Go ahead.
A problem that we come across a lot. Fuchs corneal dystrophy refers to the fact that her cornea is well easier than a standard patient. So the trauma from cataract surgery can induce a lot of swelling. And I tell those patients, you'll be sitting in the waiting room with the other day one patients who are 20/20, and she won't be because her eye will be swollen. So what you want to do is try to limit the trauma of the surgery in a Fuchs dystrophy patient. Number one, what that means is not waiting until the cataract gets overly ripe, because if the cataract is too dense, we have to use too much energy to remove it, and it's guaranteed to cause her cornea to swell. So first of all, we may take the cataracts out sooner than we otherwise would. The other thing you need to do is use some special gels that are thicker inside the eye to protect the cornea, to give it some cushion during the surgery. But the LensX procedure for someone like Fuchs dystrophy is changing the way we treat those patients. That's because, just like I mentioned earlier, the laser is doing most of the work to remove the cataract. That means it's atraumatic to the cornea. So instead of me getting in there with my ultrasound like I normally do and having to divide the cataract up, the laser is doing all of that work for us. I simply need to remove those fragments that the laser creates. So the energy used on a LensX cataract is much lower than the energy we use for a standard cataract surgery. So for Fuchs dystrophy or difficult type patients who may have swelling from the surgery, we strongly recommend they consider the LensX surgery.
Okay, great. Hey, let's take a break. Can you hang with us a little bit,
Yeah.
Dr. Jones? Okay, great. We have several callers, so if you guys are on the line, stay there because we want to give Dr. Jones a chance to talk with you and answer your question. Jan and Sherry are on the line, so stay there. And if you'd like to join us, and as we wrap up the program here, talking about eye disease, an eye surgeon extraordinaire joins us, Dr. Michael Jones with Illinois Eye Surgeons. 23 doctors in 14 locations, so boy, I mean, that's more than like Walgreens or McDonald's. I mean, you guys are all over southern Illinois there. Give us a call, 969-9797, 866-455-9797. More coming up on Vital Signs straight ahead.